Hello, this is Dr. Kavian Milani for Virginia Medical Updates. One of the major issues that we are dealing with nowadays with regards to children and adolescents is the issue of obesity. The children that have become overweight due to excess calorie intake, lack of playtime, and increasing screen time. As we all know, the kids are on screen time a lot. People do seem to be okay with that. The kids are on different media, on phones, Snapchat, other media, Instagram, and with all that that's going on, basically there is decreased time for children to have physical activity and to exercise. Also, worsening the problem is that there is an increased caloric intake at all times. So children seem to be eating more and more unhealthy foods and more processed foods, and there is definitely a decrease at this time in the intake of fruits and greens and vegetables. For the most part, also children are having decreased time devoted to energy, exercise, outdoor activity. So with all this, for some time, doctors have been recommending for the pediatric population, ages 2 to 3 all the way to 18, for a BMI evaluation, lifestyle modification, parental counseling, motivational counseling with children in that age group. There are a total of 12 studies, 10 randomized trials, and 2 basic case series. And when you put all these numbers together, it looks like this across the board, there is not really a very effective way to make a meaningful intervention, to have children lose weight, have more exercise, and to change parental attitude towards screen time and towards weight loss, serial BMI measurements, counseling, the following of BMI, motivational interviews. None of this stuff has actually worked, which is really upsetting because a lot of our time as a clinician is spent doing these things. So I think that far from being passive about this and having a defeatist or disappointed attitude, the most important thing for parents and for physicians is to recognize that the short visits with doctors on this particular issue may not help. And potentially they need to be seen in clinics or by experts that have had more focus on weight management and health parameters for children and adolescents. Then, of course, the concerted effort has been made to decrease screen time and to increase outdoor activity and playtime. Now, in a place like Northern Virginia, some children obviously are extremely involved in physical activity, soccer, football, volleyball, baseball, and track and field, swimming. These are activities that burn a lot of calories and are really very, very healthy and very good. And the rest of the time, the children are basically studying or working towards some of their academics. And so naturally, there is an improvement in these health parameters. However, for the vast majority of children, that's not the case. The kids are on Snapchat, on their phones, texting, group texting, chatting with colleagues, friends, schoolmates, classmates, and on Instagram and like. So therefore, we really need to have a real serious heart-to-heart discussion with the parents and begin to decrease this particular phenomenon. It has to be by the doctors, the nutritionists, the pediatricians, the family practitioners, and people that are vested in the well-being of the children to make an effort to really decrease and rein in the amount of time that children are playing on their devices and on TV or on their iPhones. Also, it is very important to make healthy choices. I mean, it is very easy in a place like Northern Virginia to get food from fast food or a variety of fast food restaurants, to eat out a lot, or to order pizza and that kind of thing. And that basically really is a recipe for disaster because the children are getting bad nutrition, processed food, and they're getting basic calories that are unhealthy. That same amount of calories, if it comes from fruits, vegetables, greens, apples, tangerines, watermelon, pineapple, it's a lot better and it's a lot healthier. Milk, eggs, and the like need to be added to the diet, and basically things that are processed, made in a store, that come out of the box need to be removed and definitely limited in the household. So in general, even though the medical studies at this point show no benefit to these short interventions by pediatric physicians or other doctors on the issue of weight management between the age of 2 to 18, it stands to reason that more dedicated, more devoted time towards nutritional guidance and counseling could potentially be beneficial, especially if focus is made on cutting back on screen time and increasing physical activity. This is Dr. Kavian Milani checking in for Virginia Medical Updates. Thank you.
Welcome to Virginia Medical Updates. My name is Alejandra Gonsalves, and thank you for joining us here today. Today's program is sponsored by Virginia Family Medicine. Virginia Family Medicine integrates functional and alternative medicine in their practice to complement the expertise in medical care. The areas of focus are in preventative medicine, holistic health, and weight management. Today we have with us Dr. Masa Ostavarnia. Welcome, Dr. Masa. It's a pleasure to have you here with us.
Thanks for having me.
Dr. Masa is a functional medicine practitioner and a chiropractor at Virginia Family Medicine. She earned her bachelor in biology from George Mason University and went on to complete her doctorate degree in chiropractic care from Life West in Northern California. Her studies led her to mentoring with one of the pioneers in functional medicine, Dr. Kalish. In the Kalish method, which solves many health challenges through specific lab testing, it addresses 3 key areas of hormones, GI, and detoxification. More recently, Dr. Masa proudly served as an active member in the Functional Medicine University, International Association of Chiropractors, California's Chiropractic Association, and the League of Chiropractic Women. Also in 2015, she was selected as one of the top worldwide leaders in healthcare in the Silicon Valley. It's really an honor to have you here with us, Dr. Masa.
It's my pleasure. Thank you.
Yes, thank you again. So today we're going to be discussing adrenal fatigue. So adrenal fatigue has been a buzzword in functional medicine. Tell us a little bit about that. Is that actually real?
Yeah, actually, it's a buzzword these days. Everyone is under one form of stress or another. Okay. A certain amount of stress is pretty normal and is healthy. As a matter of fact, if you don't have that much enough stress to function, you won't be productive, you won't be alert enough to work and do your daily basis activities.
So enough to push you, but not enough so that you're sick.
Exactly. However, extreme amount of stress can cause so much damage to your body. As a matter of fact, it is causing a negative effect on your health and cause adrenal fatigue, which many people in our modern society with this type of lifestyle we do have facing it. It's very common.
Okay, so tell us a little bit about what the adrenal glands actually do, so that when you have this adrenal fatigue, what is it that's that causes?
Sure. Before I start, I just want to point out in conventional medicine, when we refer to adrenal fatigue, usually it's the same line of adrenal failure. We are not talking about the same exact condition because adrenal failure is a pathology, and it is the end of the spectrum of not having any adrenal hormone in our body.
Okay.
So before we start, I just want to point out, so we are not talking about that specific problem. We are talking about a functional range of adrenal hormone in our body. As you know, picture shows there are 2 triangle glands, each sitting on top of your kidney, and it's working 24/7.
Okay.
There are many layers, many hormones producing by this gland. And the outer layer, the cortex, producing aldosterone, testosterone, and 80% of the hormones are producing is cortisol. Cortisol is the stress hormone, something that we don't measure normally because there are different ways of measuring it, and it's not normal in a routine visits with our family physician that we go. And it's very critical to know how much burden we put on our adrenal glands.
Okay, so if the cortisol levels then are increased, which is made by the adrenal glands, then obviously you're putting that pressure on there. So more stress, you're putting more pressure on the adrenal glands.
Yes, actually,
Okay.
yes. It does give us energy, and it surge, and it just gives us, prepare us for stresses that coming and facing we are daily, but we have to be prepared for it. And there are many ways, there are different types of stress that we should remember during the day.
Okay, right. So of course there's any range of stress that can happen throughout your day, but what type specifically would you say what may affect the adrenal glands?
Yes, there are 3 main type of stress that impact our body. First is physical stress. For example, you have car accident, or you run a marathon, do any active, intense sport activity, your cortisol, your stress hormone spikes. And the second type of stress is the mechanical one, which is the emotional one as well. Most people know emotional one as well.
Okay.
And the other one, last but not least, is the environmental. Environmental stresses are such as pollution, pesticides, and carcinogens. We are daily exposing to it, and we don't know that how much of it we are putting in our body.
Okay, so not all of them are negative. Like you said, if you're running a marathon, obviously you need that cortisol level to help
Exactly.
you, give you that energy. Okay, but tell us a little bit, what are maybe some hidden forms of stress that can cause us to become sick as well?
Yes, there's always hidden causes of stress. One of the main one is food allergies.
Okay.
It put a lot of pressure on our system, in our gastrointestinal system, that made us getting sick. We don't know what's going on, and it's some of the foods that we are taking. And also can be lack of oxygen or low oxygen level. People who have sleep apnea, it's very common. Their brain don't get enough oxygen. As a result, their cortisol spikes super high, and they don't feel relaxed, they don't feel rested in the morning, although they had 8-9 hours of sleep because of the lack of oxygen. The other type of stress can be spotted mostly is inflammations. You have any infection, dental infection, sinus infection, anything like that in body, it just can add more stress to your system.
Okay, and so what would be the result of this? Why should somebody be concerned about having an increased amount of stress?
Yes, unfortunately, it just starts little by little. Some people just start having mood swings. Some people crave salt, sugar, something we feel it's normal. And eventually it gets to our hormones, hormonal imbalances, sometimes blood sugar imbalances. We get fatigued, we get tired all the time, and we have poor sleep patterns. At the end, many people have poor immune system. They get sick all the time, and they don't know why they keep getting sick. All of them together shows these symptoms are telling us there is something wrong with the whole system. Functional medicine comes in this place that telling us functional medicine is not medicine by symptoms, it's medicine by cause. So we have to find out what is causing all these problems and symptoms in order to address and fix it.
Okay, so these symptoms may be causing somebody to be feeling burnt out. Is there anything that can be done?
Absolutely. There are many reliable tests out there. One of the easy one for patients we recommend is the saliva test. So it's not just a snapshot of the hormones. We give little bottles, as you see in the picture. There are tiny bottles that you take home. 4 times a day you collect your saliva, and they run a test, and they can measure all your hormones regarding your stress, ADHD and cortisol, and the ratio. By the calculations and the graph, we can start and finding what time of the day you have the most trouble and what level is your cortisol, if it's too high or under functional range, so we can help you out with that.
Okay, and then are there any other specifics to know exactly how we would know that that is occurring?
Absolutely. There are so many functional range that we have to look at it. The numbers are telling us if it's too high in the morning, so it means you're awake in the morning, but if it's too low, it seems you are just don't have energy to start your day. So by looking and comparing to the functional range of your cortisol level, we can start helping you with that.
Okay, so it's basically just trying to figure out the ranges and where you're at
Yes.
with your adrenal glands if you're having these types of stresses.
Yes.
And then is it referring to a primary care or another type of specialist that you would recommend for a patient?
In this case, usually functional medicine doctors are well trained to address the issue and help patients with not too many visits to the doctor's office.
Okay.
And it's pretty successful so far, and all the research coming out that is getting advanced, and people all in our modern lifestyle, we all do need that.
So what would be some type of treatments that a patient would consider?
The treatments are different because some people cannot handle any hormone, so we have to go holistic. We have to go based on some medications that they don't have any animal products, any dairy products in it. Based on the body, every individual has its own system. So we have to address everybody based on their needs and their body. People who have, for example, breast cancer in the past, we are not going to give them the same exact treatment as a young guy probably is like running a marathon or something. So it's different a bit among any patients.
Would you maybe recommend somebody who feels like they are feeling burnt out, but maybe they're not sure if this is caused by adrenal fatigue? I know a lot of people like to keep diaries maybe for food, but would you recommend maybe like a stress diary? Might that be a good idea for somebody who's having this?
Very good question. Before we start any treatment, we run extensive labs, sometimes a long history of patients and daily activities.
Okay.
It takes about an hour to start the treatment, and that's a personal medicine that comes. Functional medicine is a personal medicine. So we have to collect all the information before we make any decisions on helping patients.
Okay, and how long of a process could somebody expect until they're starting to feel a little bit better if it is something that's caused by your body and not just by environmental factors?
Sure, it's not too long. In 2 months, people feel the results. Sometimes first week, people who just start their treatments, they don't feel any more foggy brain. They can focus better. Their sleep pattern starts the first week of the treatment.
Okay, and would there be a specific symptom that you might encourage for a patient to keep an eye out on? If they say, okay, if you have this, then it might be caused by the adrenal fatigue. Is there a key symptom that we could take away from?
Sure, it's mostly when your hormones, you don't feel losing weight.
Okay.
So you're doing all the instructions, but you still feel you're gaining weight. That's one of the key factors. If you sleep and you don't feel rested, or you don't feel like getting up in the morning, if you have mood swings without knowing what's going on, mostly check your hormones. All your hormones should be balanced. If it's not, there must be underlying cause. Also, not all the cortisol imbalances are due to low cortisol or high cortisol level. We have to find out. One of the other problems that patients have, their blood sugar. Their blood sugar goes up mostly because of not the diet, because of the stress and cortisol imbalances. So those are the main symptoms that patients can look at.
Okay, so a lot of interesting information, a
bet.
lot that we can take away from this. So thank you, Dr. Massa,
My
for being
pleasure.
here with us today. And thank you again for joining us here. I'm Alejandra Gonsalves, and this has been Virginia Medical Updates. We hope to see you again next time.
Hello, this is Dr. Kavian Malani with one of the episodes of Virginia Medical Updates. It seems to me that one of the most interesting things that have come out in the past couple of years is some additional technology has been developed to help with weight loss. So obviously there's an exercise program that people can go on there, or dietary restrictions, commercial programs that are very beneficial. On top of that, there are always medications that are very beneficial. Most recently, there are injections that are exceedingly beneficial for weight loss. They're very difficult to manage, and they need to be used by physicians that are extra competent and have been trained in particular, have experience with these medications, given side effect profile and potential issues. But having done all these, the latest technology has really been very beneficial for management of weight issues, abdominal obesity, flank obesity, and basically allowing people to achieve a more sculpted physique, are actually technologies that use laser to burn fat. So there is this technology that's been discussed for some time, and I want to present it right now as a beneficial thing that people can use. In general, the lasers are designed, are particular forms of light wave that do affect a particular area. And people have seen like different forms of laser either in sci-fi movies or actually in, let's say, in scanners, etc. But this particular type of laser at a particular frequency is actually able to burn fat. So the way it works out is that, let's say, for example, that someone has a abdominal or flank obesity of about 5 centimeters or about 2 inches. The laser probes, when placed on the skin in a diffuse manner, do actually destroy about 25% of the fat that they're actually exposed to. So the laser goes without damaging any organ or causing any kind of skin burn or any other inconvenience. It does actually target the fat cells and permanently destroys those fat cells. And then the fat cells do release their fatty content, and basically it enters into the lymphatic system and is drained out of the body in the next 5 or 6 weeks. So this is a very interesting technology, and it's been there for some time. The one that I've used uses a laser form of technology to basically burn fat in a very methodical and rational way. And so there are a number of studies now that show that the abdominal girth, abdominal obesity, is really the cause of hypertension, diabetes, cholesterol, cardiovascular mortality, morbidity. And if one can imagine that a particular laser technology with no invasiveness, that does not probe into the body, go into the body, is not a surgical procedure, you don't have to be anesthetized or knocked out for this thing, it can basically be completely effectively destroying, zapping permanently 24-25% of the body fat. Well, that's a really exciting option for people that want to lose the weight but do not want to expose themselves to any surgical procedures. So this technology that's coming out now is really beneficial. It's been FDA approved and is available in the market. And so I think that that's a really very exciting development for people to actually do this. I did this procedure on one of my nurses a few weeks ago, and basically in the course of 1 week, she lost about 1 inch of abdominal circumference, which I think is very nice and very beneficial. In general, if this trend continues and if these products are used appropriately and by skilled physicians, then basically they could really enhance any other weight loss program significantly and can be really the cause of much benefit. Because if we think that the central obesity, the abdominal girth, is the cause of a lot of problems, then imagine the destruction of these fat cells by a technology that is non-invasive and from the outside of the body could be very, very beneficial. And this is I think the benefit of this particular program, that if it's combined with a weight loss program, it could really benefit the patient and could really destroy these harmful obesity, the fat cells that accumulate and are very metabolically active and are the cause of much misery and really morbidity for the patients. So the technologies that are coming out are exciting, are interesting, and there are two main technologies, and they're both beneficial. The one that I've had experience with is the one that is basically using a laser to destroy fat cells, and I found it in our patient population to be very beneficial and a non-invasive way of managing body sculpting and weight loss. This is Dr. Kavya Milani for Virginia Medical Updates. Thank you.